present to you about role of kinesthetic system in sport. So, first is definition of the muscle receptors. So, the kinesthetic taste, sense of position and movement of our limbs have been the subject of speculation for over 400 years. The prevalent view is that it is indicated by the muscular function, with the role of the child being played by the skin and the receptor together. The problem with muscle as a position detector is those who are able to generate impulse is respond to change in muscle length and physiomotor activity. The central nervous system should be able to distinguish between activities for two sources. The observation yesterday, in the sense of the tiredness and during the burden of suggestion, that the additional source of kinesthetic. Next, kinesthetic condition is test on the middle part of the middle finger joint interphalanges when the arms are fixed so that together it is effectively disengaged from the attachment to the muscle. The subject required to detect the direction of the movement of degrees and use 5 angel speed vary from middle position under control condition. After injection, intra-articular plasm expander, and after injection of intra-articular local anesthesia. Enhanced performance kinesthetic with injection plasm expander injection and deterioration after local anesthetic injection. So here we attach the illustration of muscle receptor, which is sensory receptor in skin and joint receptors. As you can see, at the normal joint, we have yellow bone marrow, periosteum, spongy bone, compact bone, ligament, synovial membrane, joint cavity, which is contain the synovial fluid, articular cartilage, joint capsule, which is include reinforced by ligament.
Assalamualaikum warahmatullahi wabarakatuh. Today I will present to you about basic anatomy of receptor. Okay, for the first, muscle receptor. A general sense is one that distributes throughout the body and the receptor cell within the structure of the organ. Okay. And for the joint receptor, joint movement involve a variety of technique, like used to loosen the tissue around the joints. Every body joints in your body. Okay, for the cutaneous joint, cutaneous receptor. Sorry, my bad. The cutaneous receptor are the type of the sensory receptor that found in dermis and epidermis. And for the cutaneous receptor, they are part of the somatosensory system. Okay, for the next slide is about the physiology on how kinesthetic system can contribute to motor control. And how the kinesthetic contribute to motor control? We don't know. Okay, let me explain to you. The individual joint rotation of a movement, every movement we are doing, a sequence might be controlled either by central motor plan or by motion dependent sensory input. This study examines how the nervous system use the kinesthetic input to control a multi-joint movement.